Welcome to our NPTE Question of the Day series, presented by Typical PT. Today, we're going to be discussing a question from Typical PT's platform. Let's jump right in. The question is, in an outpatient cardiac rehabilitation center, a 45-year-old male patient with a known history of chronic cocaine abuse presents for a routine evaluation. He reports experiencing shortness of breath and intermittent chest pain over the past few months. His vital signs are as follows: BP 60 over 95 millimeters of mercury, HR 110 beats per minute, RR 22 breaths per minute, O2 saturation 95% on room air. Physical examination reveals a mild systolic murmur, best heard at the apex. Given the patient's history, which structure would you expect to be the most affected? A. Left atrium, B. Left ventricle, C. Right atrium, D. Right ventricle. Go ahead and pause the video right now, think through the logic, and lock in your answer. When you are ready, hit play again to see the solution. Welcome back. The correct answer is choice B, left ventricle. This is correct because chronic cocaine use predominantly affects the left ventricle. Cocaine's stimulatory effect on the sympathetic nervous system leads to increased heart rate and blood pressure, contributing to left ventricular hypertrophy and possibly reduced ejection fraction. This correlates with the patient's symptoms of chest pain and shortness of breath, as well as the systolic murmur at the apex, a typical sign of left ventricular strain. Now, let's look at why the other options are incorrect. Answer choice A is incorrect because the left atrium is typically affected in cases involving mitral valve disease or atrial fibrillation. While it can be secondarily affected by left ventricular dysfunction, it is not the primary site affected by cocaine abuse, which more directly impacts the left ventricle. Answer choice C is incorrect because the right atrium is more commonly affected by conditions that cause right-sided heart failure or tricuspid valve disease. Answer choice D is incorrect because the right ventricle is generally affected in conditions leading to pulmonary hypertension or chronic lung disease. While right ventricular dysfunction can sometimes occur, it is typically a secondary consequence of left-sided heart failure or other pulmonary conditions. Now that you've gone through this case, take a moment to jot down all the key points in your Typical PT digital notebook. Use it to organize your notes, highlight concepts you found confusing, or mark areas you want to review later. This feature isn't just for note-taking. It can serve as your personal reviewer, helping you track what you've mastered and identify topics you still need to strengthen, ultimately improving your retention and understanding. Thanks for watching today's Question of the Day. We're dropping new NPTE prep content every single day to help you pass with confidence. Follow us on Instagram, Facebook, and TikTok at Typical PT for daily study tips, quick reviews, and motivation to keep you going.